Hi, I just want to welcome some special guests today to a conversation with our young lung cancer team. I myself am Leah Phillips. I was diagnosed with stage 4 non-small cell lung cancer, EGFR exon 19, 5 years ago in December of 2019. I was diagnosed here locally in Louisville. I shortly went to Vanderbilt for a second opinion, and now I'm actually a patient at MD Anderson and just had a lobectomy 7 weeks ago tomorrow. So that's kind of who I am. I'm one of the co-founders of Young Lung Cancer Initiative, and I'm excited to have a friend and fellow lung cancer survivor with me, Samantha. I'm going to let her kind of introduce herself, tell a little bit about her story, and then I'm going to let you introduce the next guest, Samantha.
Hey everyone, I'm Samantha Morell. I am based out of Park City, Utah. I was diagnosed in February of 2024 with non-small cell lung cancer with a HER2 exon 20 mutation. And I have been very active in the young lung community and continue to share my story to make people aware of what's going on with young lung cancer in the world. So we have an incredible guest today, Dr. Kyle Concannon. He is located out of Texas at MD Anderson, and I will hand it over to him to give a more formal overview of his background and where he comes from and why he's here with us today.
Thanks, Samantha. I'm Kyle Concannon. I'm living here in Houston, Texas at MD Anderson, where I specialize in lung cancer. And I was really eager to join on the podcast here and speak with you all, particularly in the Young Lung Initiative group, because I also had all these experiences growing up that inspired me to go into medicine for people who were diagnosed with really critical things, my family members, really young. And that was a source of inspiration for me, a source of motivation to pursue this whole path toward being an oncologist, which takes forever. And for me, it was so powerful and so motivating. And I'm seeing all those same parallels that I was feeling in the patients here, in the group here. So I was really eager to come on and talk a little bit about my story, how I was able to leverage that into caring for patients, caring for people who are going through their own struggles, and then figuring out ways we get to continue to move forward together and kind of bridge these gaps between patients and providers, not only in the clinic, but also in the research field.
Kyle, why don't you tell us just a little bit about your background, a little bit more in detail, just so that the patients and caregivers that are watching understand how you can relate to us.
Yeah, I didn't want to steal too much spotlight too early here, but
No.
yeah, my history is I grew up in a small town in southern Vermont, and I grew up in a family that was a fairly common family in rural US. My father didn't complete high school. My mother was a stay-at-home mom. And growing up, we had some healthcare challenges. We had a brother who had a very rare genetic disease, a liver disease, and he had a life expectancy of about 13 to 15 years. That's as long as anyone had really lived with that disease. And he's exceeded that, but we didn't expect that at the time. And then, growing up with those challenges, he was always sick. He was always in the hospital, and we never knew how he would do. We didn't understand the disease. We didn't understand the treatments he was getting. One example was every 4 hours, he would have to drink cornstarch because his body doesn't metabolize the sugar in his liver. He doesn't have access to that. So he always has to have some sugar source digested. So all of our life was built around this genetic diagnosis that we didn't understand. And then, one point he developed appendicitis, which made him really, really sick. And then he was on the verge of dying, really. And that ended up he did okay, but we, went to the Make-A-Wish Foundation. It was a very big event for us. And you see how communities rally around that kind of event for someone. But that inspired me to go into understanding the genetic basis of disease. Here's some kid that didn't do anything wrong. It's the hand you're dealt, and you get this thing, and it devastates families. It's really, really hard for everyone to cope. But I remember even when I was in medical school, my mother asking me, could we have tried something to wake up this sleeping protein in him? The genetic disease causes the protein that breaks down sugar to not work. So she's like, could we have done electroshock therapy to wake up that, to jolt that protein? And as humorous as it was, me and my brother always being rivals, thinking of her actually going through with that. No, it wouldn't have been effective. But also, you have this mother who's like, for years, she had this question, and she knows it sounds kind of crazy, but she didn't have that connection with the physicians to be able to ask this thing that was plaguing her for like a decade or 15 years. And to me, that was just really powerful because I've seen that a lot in my patients. You have some question, it feels stupid, and you're like, you don't want to be laughed at, you don't want to insult, the doctor's intelligence, you don't want to waste their time. And that's the dynamic we had when he was sick. My brother like actively dying as far as we know, but we didn't really ask a lot of follow-up questions. They were hurried in an ICU and we didn't want to be a burden on them. And I remember having that feeling. And not only did I want to better understand the underpinnings of disease so I could like cope and have a good sense of what was going on for myself, for other people, but also it just felt like we were in different leagues. It felt so different. And then I went through that path to become that thing. And here I work at MD Anderson, like, the most that thing that exists, as far as I know. And I don't feel like I still feel like that kid, but I can see in my patients that exists, that barrier seems to exist. So it's really my hope and one of the big driving things that allowed me to persevere through all the challenges I went through coming from my background to minimize that difference, and I can speak to how powerfully that motivated me. We had other medical challenges in my family. I had a sister who underwent a terminal extubation after a car accident, meaning she was hit. She was on life support, and we had to make the call to end care. She ended up living through that, but there were a lot of challenges there. And those things really devastated our family. We didn't have a lot of money. We didn't have a lot of understanding of how to navigate those things emotionally and how to cope. My family, like a lot of rural families, struggled with things like addiction, like depression, and it ended up really fracturing the family unit. And I went out to try to prevent those fallouts from happening to other families by better integrating into medical care. But it was hard. You walk into an academic group that you don't belong to. I didn't feel particularly like I belonged with the kids of doctors, and I wasn't all that intelligent, or I didn't do that well in school at that point yet. I had to learn that. You feel pretty inadequate for quite a while without a financial safety net. During my undergrad, there were transient moments of homelessness where I had to like go sleep in the woods for a week during a vacation kind of thing, which in Vermont is pretty socially acceptable. So I at least had that. Everyone's like, "Oh, you're having this great vacation," and they don't know you don't have anywhere else to go. But yeah, but those were real challenges. But the thing that I anchored onto to persevere through those things was this belief that I lost so much and my family lost so much, and I wanted to prevent other people from experiencing that. So not only does that, I think, make me a better, well, I would say better, but it's what made me into a doctor. But also, I see that feeling so much in the patients that I care for, their families, these communities. And it's like, that is such a powerful feeling, and I felt firsthand how productive that can be if it's fed. And some of the most important things that I think we can do to feed it is to minimize the barrier between us, because we're all just people, we're all struggling. Like, everyone has their challenges. So for a physician to act like I don't, I think is a little, I wouldn't say disingenuous, but there's a way to be more honest and connect better by being a little more transparent about the things that I struggle with, and hopefully connect better with the patient, with, whoever's on the other side receiving help. Those are the kinds of things that I think help us facilitate moving together to more effectively treat the patient, and then one day get these diseases behind us and work toward cures.
Well, your story is amazing, really. Being from Kentucky, there are a lot of
Yeah.
those kind of stories, people that come from nothing and, work their way to, like you said, being financially secure and socially secure. And I know people like that. I've watched that happen, and I think it is just a testament to your inner strength, really, and your will to make a difference. When I was diagnosed, I'm an educated person. My husband is an educated person. But when you have your life turned upside down and you can't see 3 feet in front of your face, really, for all the emotional trauma that's happening, as well as the physical aspects of what's going on, it is intimidating when doctors walk in. I was laying in a hospital bed with a chest tube in. How more
Yeah.
vulnerable can you be? I couldn't even get out of the bed, and they're standing there in the white coats and the ties and, older male. It's very hard to communicate with doctors that you don't feel a personal connection to. My second opinion was a female physician oncologist at Vanderbilt who was about my age, had kids about my age, and we spent 2 hours talking. And I just really felt like that changed my whole, I don't know if it was like hope was different. Like I felt like she really
Mhm.
believes me, I can talk to her. And I don't know if Samantha's had any experiences like this with different doctors that she's dealt with, but what would you say is the best way, I guess, from a patient's perspective to help bring that barrier? What can we do as patients, especially young lung cancer patients, because lots of us are younger than our physicians, um,
Yeah.
to kind of make that a better working relationship?
Yeah. I mean, one, I think the impetus is largely on the physician. We're not the one in the vulnerable seat. So I think there are a lot of positions where we don't have a lot of time, where we feel rushed. I think it's really the responsibility of the medical team to meet you where you're at, because you're the one going through a devastating life change. Like
Right.
we're at work. We do this all the time. So that would be the first thing I would say. But to your point, where everyone has something to add, the things that I think would be probably most helpful are, one, what I see a lot of people doing now more than they've ever done before, as far as I can tell, is educating themselves. And I was joking with Samantha about this the other day, where I'm like, your mom probably knows more about certain elements of lung cancer than I do. And that level of education is, one, very vulnerable for a doctor. Like we're supposed to be the experts. And then the patient comes in, and I've had this experience multiple times, where a patient comes in and they know such exquisite molecular detail about their their mutations, their disease. They're asking about treatments that we haven't really used or I'm not as familiar with. And it's really vulnerable for me to say, wow, like I actually don't know the answer to that, but I'm really happy you're educating me on this. Like that's important. That's my job. That's what I want. And that's how we work together. So I think that level of education, just keep pushing that to the point one can. It's not, I wouldn't say it's an obligation to have a good working relationship with your doctor as you go in there and outshine them. But you should, if you're able to learn more, and for those who are interested in learning more, do that and express that. And then don't feel hesitant to ask any question, no matter how dumb it is. Because some of the questions that were absolutely like crazy ideas years ago are completely being readdressed now. And there's no question that's too crazy. There's nothing that's too stupid. We don't have all the answers, and it takes thinking outside of the box to get there. And sometimes you need that external perspective to say, this seems really obvious to me, but I don't. And then there's always that, oh, I don't know, I'm not a doctor. And it's like, but what if you were? Like, just forget the title. Like, and bring your thoughts to the table. It adds a lot, but it is vulnerable for you. And if your doctor reacts offensively, it's probably because it's vulnerable for them too. So push through that. Ultimately, like every other, social dynamic that exists, if you always feel like you're not connecting with your doctor, even if it were me, sometimes you need a different fit. And that's okay. Like that, there's nothing wrong with that. The doctor gets it, patient gets it. Like it's your life. You are priority number one.
I think that's good advice. I mean, I've felt that before where I've had an oncologist where it just didn't click, and she was great. I mean, she wasn't doing anything wrong. It just wasn't a good fit. And, you do have to stand up and say, I think it's time for a change. And I would call breaking up. Like breaking up with the doctor is kind of awkward and hard. And I usually make my husband do it. Like like, oh, so, it is hard, and it is what you need to do. The patient, like you said, is number one. We're the ones living it. You're at work, and I never really thought of it that way. I always think kind of like teachers live at school, kids think you live at
Yeah.
school.
Yeah. Yeah.
Yeah, but that was a good perspective that this is your job. You do this every day, and we don't. So I think that's great perspective. Samantha, do you have anything to add? Like anything, any kind of experiences you've had?
Yeah, so Dr. Kyle, I call him Dr. Kyle. Dr. Kyle and I last week about how when I was first introduced to him on a personal level through a friend, I was terrified of him. And
Yeah.
I was terrified to even just reach out for an informal phone call and have a chat because he was a doctor and he knew about oncology. And so getting over that barrier, I think, is critical. And I have got better throughout the process of my diagnosis. I have got better in the sense of now I will share research with my oncologist. I'll share papers, I'll share, different studies, and he will read them and he'll say like, "Oh, I spent the evening reading that document you shared with me and like this is my opinion." And so I'm very fortunate, and he jokes about it. He's like, "Oh, you're that patient, that I have to do extra curricular research for, so to speak." But we joke about it, and that makes me feel more comfortable that like he's okay with it. And he actually said the other day that he learned something from me and he appreciated that. And as Kyle said, like that's very vulnerable of an oncologist, especially mine, who's been around for like 30 plus years, to say. But that vulnerability made me even have a greater connection with him and feel more comfortable that, okay, this really is a dynamic where I can just ask stupid things, share papers with, etc. And it becomes more of a partnership because at the end of the day, this is my life. And like, I need you to work with me, doc, to try and figure this out and extend my life for as long as possible. But I do not think everyone's as fortunate that we've discussed, because it is vulnerable for oncologists, and B, to have the confidence to even present something to your doctor that they might not know is a barrier that needs to be overcome. And it took me a long time to get there. And it was assistance from my husband being like, he's just a person, like you said, right? Just a person. Just share it. What's the worst that can happen? He fire you? Like, so it's getting over that mental barrier of this really is a partnership. We're in this together, and getting over that kind of power dynamic. And if it's not a good fit, move on.
Right. I think that's great. And I think it's interesting that your husband was the one that says he's just a person.
Yeah.
And I think, my husband will say things like that to me, but I think, and I'm not stereotyping here, but a lot of times I'll say I'm a more of a feeler, like an emotive person, like,
Yes.
and my husband is more, statistic driven. So when it comes to having different personalities, that's tricky too, because Todd will stand up and say, "Well, I read this, this, and this," where I'm like, "Oh, don't hurt their feelings," and I think that's a lot of patience. You don't want to insult your physician because you do think of them as being like the smartest, the end all be all in this area. But what I have also learned, and Kyle, this would be interesting to get your take, and maybe Samantha as well. A lot of lung cancer patients start at community hospitals, not at research hospitals. So, like, for instance, when my first oncologist was a general oncologist, that he supposedly specialized in lung cancer. And to me, I have great respect for these general oncologists because I cannot imagine seeing all these different cancers coming in and trying to keep up, what's the best for everybody. But it's almost like, they're a jack of all trades, a master of none. And it was that in that situation, I feel it's extremely important that patients are educating themselves to some level. Doesn't have to be a PhD level, but to be able to ask the question. So, Kyle, do you have advice for people who are not seeing like a thoracic oncology team?
Yeah, I mean, I think my perspective is that how much someone cares is probably more important than what they know. If they're willing to work with you and they adapt to your needs, whether they knew how to solve that question a year ago or not, if they're able to show up and they care about you and they address the question now. And I think that's how a lot of people in the community kind of have to function if they're seeing a large scope of patients. And if they have the time and then they're able to dig into it, they can come up with great solutions. Like I think there's a real challenge to being in the community in the volume they see and the scope they see. And I had a lot of close friends who are brilliant, who I graduated who I graduated fellowship with, and I think they do a really, really good job in a hard environment. Now, I think one thing a lot of people don't appreciate is how fast this field is changing. So I want, patients to keep that in mind, or whoever's going to see a specialist with particularly lung cancer or any other kind of cancer, is that the field is changing so quickly that if you're reading about it right now, you will likely know something your oncologist doesn't, just in the nature of how quickly things come out. And it's particularly true when we come to some of the more rare diseases. And lung cancer has a smattering of those. So there's a group of rare mutations, fusions, where if you go not even to a community oncologist, almost certainly if you're looking into the research, you'll find things that they're not yet aware of. And you get the awesome opportunity to say, hey, look, I've got this thing and we've all been talking about, where it's, yeah, we're all just people, we're all just trying our best. But, I think if they care about you and they're invested in you emotionally, that's going to be the primary driver. Because think of, all the situations in your life, and this is true for everything always, where it's more how much you show up and how much you care than what's on paper in terms of your CV or whatever you knew a year ago.
I think that's very true and definitely something to consider for sure. Samantha, have you had any experience kind of like where I know you said you shared with your oncologist some information, but do you feel like this is an issue for other young lung cancer patients that you've spoken with?
Oh, 100%. I absolutely do. And initially I was diagnosed at a community hospital like you as well, with a chest tube in at the same time as well. So sad that we can relate to that. But I went to a community oncologist initially, and I talk about this quite often, where I did not have a good experience, and we were planning to move regardless, but it initiated us to 100% be like, we're moving. And I would say 99.9% of the population cannot just say, okay, we're moving. So I was fortunate in that circumstance. And so if you are in a community hospital with a general oncologist, it's like, okay, well, how do I get that second opinion at a large institute that I maybe travel to less frequently, to have that touch point with a thoracic oncologist, and maybe they can have that dynamic between them in addition to yourself. I think that that's essential. I mean, absolutely essential. I talk about this openly, that the community oncologist told me a just blanket statement I had 9 months to live, with not even knowing my mutation. And I don't wish that on anyone ever. And so that understanding of lung cancer as well as your specific mutation is critical, to give you the advice that you need. As Kyle mentioned, like my mom knowing more about my HER2 mutation than most doctors, she has a scribble pad and it literally lists out every alphabet soup part of my mutation and like how that interacts with different treatments. I use her regularly as my molecular scientist, so to speak, to help me out, figure out how I'll respond to different things. I know not everyone's going to dive that deep into it, right? Overcoming that barrier of like, oh, I see this new study, or I've seen how a TKI plus chemo has better outcomes, and like maybe we haven't discussed this yet, so I'd like to discuss this. And I think there's a way to go about it and have that conversation with your oncologist. This is making me think maybe we can put together something of like how to start that dialogue, or like conversation starters with your oncologist. I know that sounds so stupid, but like it's creating those sentences that allow people to feel empowered to have those conversations. I think that in the way that you present, you have new information that they'd like to look at, could come across as offensive if you're not careful, right? Learning how to say things in an appropriate manner to ensure you open up that partnership rather than shut it down more, I think is critical.
I do like that idea of like conversation starters, kind of the role playing, that's
Yes.
people learn. And
Yeah.
I think it's just very important. I think we're in a kind of a day and age that's unique. Not that the internet just came alive or anything yesterday, but now we're in a young lung cancer community. One, we're younger. we're using technology. We have so much information readily available that it's changing. I think it has changed, it is changing, it will continue to change. This whole, how much does the patient get involved in their care? How much does the patient know? Because we're no longer just sitting there listening like, okay, the doctor says this is what we do. This is what we do. We don't know what else to do. So I do think we're in a very different type of situation than some of even the oncologists that are seeing us were when they first started practicing medicine, when there wasn't all that readily available. So I do think we're just kind of like in this era of the patient wanting to be involved in their care and have many aspects of care, not just the traditional, but also the more integrative, medicine part of it, the mental and emotional part of it. I think younger patients, a lot of us are wanting that whole treatment, not just the one little thing of lung cancer, the lung cancer, we want the whole shebang. We don't just want a little tiny piece. So I don't know if, Kyle, you've seen that, or you think that as well, that people are.
Yeah, I had almost an identical conversation with Samantha the other day, where I echoed your point, which is the internet's fairly recent, and that now patients, and I even that the differential between patient and provider I struggle with sometimes, because we're all just people here trying to help each other. But like if I were diagnosed with a lung cancer, I wouldn't have the ability 20 years ago to just learn everything there is to know. But nowadays, largely you can, and a lot of the stuff is publicly available. And I even know, people who will get, subscriptions to articles and everything, and they'll go in and they'll read specifically about their mutation with their lung cancer, and they show up and have very, very nuanced and high level questions. And there's this, I'm feeling in real time, the community is trying to navigate, okay, well, I don't have this credential. I don't have an MD, I don't have a PhD, I'm just a whatever, but I have this question. And I want to challenge that feeling, because the PhD or the MD is a surrogate to say this person has knowledge. But if you just get that knowledge and you come in with a good idea, like I don't care if you have a PhD, I don't care if you have an MD. If you come in with a really good question that's very relevant to your cancer, that has the ability to dramatically change your life individually, like you, the person sitting in the seat, but it also may have the ability to help the lives of others. So I think, forgetting this idea that one might require a credibility, like an MD or whatever, to work in this field, I think we need to get rid of that, because patients can dramatically contribute. I've seen it. I've worked with patients. They're on our teams in different capacities, where they come in with the ideas and they're the ones driving. And the playing field is getting much more flat in terms of the knowledge discrepancy. But we as providers have to learn how to navigate that and hear in real time very quickly, particularly with the advent of AI, which has the ability to integrate information way better and more, quickly than I certainly can, if it's accurate. Yeah, that's exactly. I mean, this is exactly the conversation that I've been having with a lot, not just Samantha. The field in general is evolving in this way, and you, the patient, that is in the seat, the person watching this podcast, is in the driver's seat, like right now. The world is changing, and you're the driver, and that's a good thing. That's a good thing. We need to be on the same team together. I overcame a tremendous amount of barriers. I persevered all to have this responsibility, this gift, to be able to help people struggling with something. And that's why I laughed so much when Samantha was like, "Oh, I'm nervous to call Dr. Kyle." And it's like, I've worked my whole life to have this opportunity. So doctors weren't given this burden of a job to, you're not a burden. Like, we worked really, really hard to have the opportunity to do exactly what we're doing. And you coming in with a question and getting involved is exciting for us. Like, it's a good thing. Although I understand from the other side, if someone's really busy, they might seem put off or something. I would push through that for sure.
Well, thank you. So as you all can see today, we've had a really interesting conversation amongst the three of us, two patient perspectives, two advocate perspectives, and then also, an educated doctor in the situation that, is really relatable. Like, he's not intimidating. And probably if we sat down with our doctors elsewhere and didn't meet them when they were in the exam room with us, we would probably feel like they're more like real people. So I was just going to ask Samantha, and then maybe Kyle, you can just share like one last thought you'd like to give the viewers about this kind of conversation.
Yeah, as a wrap up, I would say to get over that mindset that you can't bring things up with your doctor. You absolutely can, especially as stage 4 lung cancer patients. We want to live for as long as we possibly can. And if you're not sharing new information that you're learning that you want to share with your doctor that could really make an impact on your life, we need to feel empowered and comfortable enough to be able to share information and create a partnership dynamic between your doctor instead of a scary doctor pedestal that we often have with our doctors.
Yeah, and adding to that, I would say from the physician standpoint, we feel that difference, but also the physician has a job. Like our responsibility in this social contract is to be what you need. And we've worked a lot, but there's also a lot of social praise we get. The salaries tend to be higher. Like we get a lot of things as a reward of holding up our part of that contract. So like we should be, held to a certain level of accountability. And part of that accountability is when you come in with a question, we are that person. Like this is our not only our role, responsibility, but the thing that we've worked really, really hard to get the privilege of doing. And now in an era where patients have so much to add, that I wouldn't think of it as, will I upset my doctor? I wouldn't think of it as they're really busy. More, you actually have value to add. And I'm not just saying that to make people feel better. Like this is a true statement now more than it's ever been. So I think there's a lot to look forward to, and try as hard as you can to replace those feelings of this big difference between us coming together and working together and bringing your thoughts and your ideas as a team.
I like that. Both of you had a good opinions and messages to send out as we end this podcast. I want to thank both of you all for being guests today. I look forward to working with you all maybe in the future on some other things. I think we have a lot we could talk about here, and unfortunately we can't cram it all into one little segment. So for those of you watching, stay tuned to learn more from all three of us about different topics related to lung cancer, young lung cancer, and the patient-physician kind of dynamic.